Hi, my name's Aubrey. I'm going to demonstrate how to give an intramuscular injection. So first thing you want to do is look at your doctor's orders, what they've prescribed. Today they've prescribed 0.4 mils of normal or of sterile water. So then you're going to look at your patient's chart and make sure there are no known drug allergies, especially an allergy to the drug you're giving today. Next, you're going to want to gather all of your supplies. For an intramuscular injection, you can give a 19, 20, 21, or 22 gauge needle, and that can either be 1 inch, 1.5 inch, or 2 inches in length. Today I'm using a 3 milliliter syringe with a 22 gauge needle that is 1.5 inches in length. So then you're going to pull your medication from the stock, first checking the expiration date, making sure it's not expired. And then you're going to make sure the label matches what the doctor has ordered. And you're going to do this 3 times. You're going to do it when you pull the medication, when you are pulling the medication up in the syringe, and you're going to check it again when you're at the bedside of the patient. Next, you're going to wash your hands, and then you can go ahead and start cleaning your medicine top, remembering the 6 rights of medicine administration, and that is right patient, right drug, right dose, right time, right route, and right documentation. Then we can go ahead and take our syringe with the needle. You're going to draw up 0.4 mils of air first. Cut the needle. Push the air in. Now you can draw up your medicine, drawing it up slowly, making sure you're not getting any air bubbles. Okay. And then we can recap the needle using the scoop method. And then we can go ahead and switch our needles out for the patient. And now I would label this needle with the medication that it's in it, the amount that's in the syringe, and the patient that it's going to. And I would go ahead and transfer it to the patient's room. And if there are any known antidotes for the medication that you're giving, you would want to have those on hand. Also, before you give the medication to your patient, you would do a focus assessment if it's necessary, such as for medication of like morphine. You need to check and make sure the respirations were below 12. And next, the sites for intramuscular injection are your deltoid, and you put 2 fingers below their shoulder. And then your vastus lateralis, you put a hand on the top of the thigh, on the bottom of the thigh, and go in between. Your ventral gluteal, you make a V shape with your hand and put it on their trochanter, and then you would put the injection in between your fingers. And the dorsal gluteal is going to be the outer upper quadrant of the buttocks. Next, when I go into the patient's room, I'm going to identify myself. Hi, I'm Aubrey. I'm your nurse. I'm going to be giving you an intramuscular injection of 0.4 mils of of sterile water. Then I would look and ask the patient, do you have any allergies? And then look and see if they have an allergies wristband on their wrist. I would also look at their wristband and have them identify themselves and tell me their birthday while I'm looking and making sure their birthday and their name matches. Then I would wash my hands and go ahead and apply my gloves. I'm going to choose the site I'm going to give, clean it for about 30 seconds, let it dry completely, and now I can go ahead and give my injection. For intramuscular, you can either pinch the skin, or pull it taut. I'm going to pull it taut, go in with a dart-like motion at 90 degrees, let the skin go, slowly inject your medicine, pull the needle out, recap the needle, and dispose of it properly in the sharps container.